My name is Stefan Dye. I live in San Diego, California, and about 4 months ago my back started to hurt, and it started to hurt a little bit worse and a little bit worse, and then it got to the point that I couldn't stand up for more than 30 or 60 seconds at a time, and it was extreme pain, and I was minimizing the process, thinking it wasn't that big of a deal, until I couldn't stand up anymore, and then I decided this is a pretty big deal. So I went to my physician and asked for an MRI. Got an MRI, and on the day that I was trying to get my MRI, to get somebody to look at it, I was in tears the entire day because I just couldn't stand the pain anymore, and I was at the time taking some pain medication, but it wasn't helping, so I ended up going to the emergency room carrying my MRI disc, hoping that somebody would read it and tell me what I needed to do, because I had no idea what was going on with me or why I was suffering that kind of pain, and literally in tears all day. So I sat in the emergency room for 4 hours waiting for somebody to see me on this day, and while I was waiting, I had enough foresight to bring my laptop, to bring my computer, so I was researching on the internet what in the world was wrong with me. I was researching sciatica and learning about the back and trying to figure out what was happening with me. And what I discovered was that this is not a simple thing. This is really a pretty big deal, and that a lot of people, in my options, my treatment options, what I really cared about included, really it looked to me like I was going to have a surgery if it's what I thought it was, which was some disc material touching my nerve. And so I started looking at treatment options, and in my mind, having back surgery was this terrible, awful, scary thing that you wanted to avoid at all costs. And my friends were saying to me, my buddy had back surgery and he was laid up in bed for months, and my other buddy had back surgery and he couldn't go back to work for years, and scary, scary, scary. So I continued to research and just at random, with luck, found Dr. Ditzworth's website, and was actually in the beginning I thought it was a little bit too good to be true. It's going to be non-invasive, and they're not going to cut any bone, and they're not going to cut any muscle, and there's not going to be any scar, and no bleeding. I didn't know. It just seemed like that didn't make any sense at all. But as I continued to read, it turns out that he's a neurosurgeon, and I looked deeper, and there's no lawsuits against him at all ever. And we looked deeper, and he's written many, many papers on the subject. And you look deeper, and you think, okay, this guy's the real deal, and maybe I just got lucky and was able to stumble across this. So was able to get in to get an appointment. Actually, the next day, miraculously, I don't know how that's possible, but got in, was able to see him. And he said, it looks to me like, based on this MRI that you brought in, you've got a lot of disc material, and this is what we can do, and this is how we do it. And he talked to me for, I want to say 2 hours that day. It was a long time. It was a lot of time we got to talk. And then I went back home and needed a second opinion. Everybody around me was saying, got to have a second opinion, got to have a second opinion. So I found a surgeon in San Diego who has done some 5,000, he says, laminectomies, well-respected, sort of a popular guy in San Diego. And he said, based on what he was seeing, you have to have surgery. There's no other treatment for this. And he says, I've done 5,000 of them. It's no big deal. What we do is make an incision. It's this long, and then we open it up, and then we cut a hole and cut the bone a little bit, and then we go in and we get the disc material out, and we suture you back up, and you're going to be fine. The way he described it, it didn't sound like that big of a deal. But I had already done some research and knew that cutting bone didn't sound good. And I remember, it's funny because I said to him, so you skipped over the cutting bone part a little bit. I said, how do you do that? And he said, well, we use, and he named some device, I don't know what it was, some scientific sounding bone device. And he said, it's no big deal, we use a such and such, and then, it grows back anyway, it's not that big of a deal. And I thought, okay, I still think Dr. Ditzworth's strategy is going to be a lot better. Later, I have a friend who's a doctor, and I said, what is this device? And she said, well, that's what they call a bone saw. And I said, oh, I don't think I really want a bone saw. cutting into my back, and just continued to do the research and looked a little bit deeper and thought it made a lot more sense, and was able to get in to see Dr. Ditzworth. Actually, the following week we were able to do the surgery. So I walked in for the surgery. I did walk in that day, but was only able to stand for 30, 60 seconds at a time, and that was heavily medicated. With no medication, I just would have died. I don't know. It was unbelievable pain. After the surgery, I stood erect for the first time in weeks. Before that, I walked around bent over like an L because I couldn't stand up straight. Walked out of there, and ever since then, I feel like I'm healing a little bit every day. I stand erect. I walk normally. My physical therapy is going quite well, and I think I'm going to be great. I think I'm going to be super, and I feel fortunate to have met him. And I hope that if you're suffering from the back pain that I was feeling or anything like it, and you haven't met him, you'll find a way to meet him. Get on an airplane. I drove 2.5 hours, suffering terrible pain just to have an opportunity to meet him. And if you have to fly, whatever it is, get there, meet him. It's worth it.